Hi, my dear doctors. Today we are going to discuss about two questions, two high yield questions from USMLE, and it's a very important question. So you must go through these questions and listen carefully. A 64-year-old retired shipyard worker has been experiencing shortness of breath, a cough, and chest pain for 5 months. In that time, he has lost 14.5 kgs. He develops progressive ascites and ultimately dies due to pulmonary embolus. Autopsy results are shown in this image. Exposure to which substance is a risk factor for this patient's disorder. So, if you studied about the pneumoconiosis and the interstitial pulmonary diseases, you must get some idea that what is the given image and where is the pathology. So, and what type of substance or what type of uh, chemical, or we can say substance that deposit into the lungs. So here they said that the patient has some pulmonary symptoms like shortness of breath, cough, chest pain for 5 months. It means that he has some sort of disorder that is related to the pulmonary system. Okay, clear. Number second, progressive. The condition is not subsiding, it is increasing, and after some time, he develops progressive ascites and dies because of pulmonary embolus. It means that the substance that present into the lungs, they are not only disturbing the gaseous exchange, they are also damaging the blood vessels. Because of that, there is a chance of formation of pulmonary embolus. So in case of all pneumoconiosis, we can see we can say that these are the diseases related to the interstitium. So this patient is working shipyard. It means that something related to the shipyard workers that is common, and they are deposited in the lungs of the patient. So if you read about different type of pneumoconiosis, you must get some idea that what type of substance mostly deposit in the lungs of the patient, of the people who works in shipyard. So in shipyard workers, the most common thing that they inhale and they face daily in their daily life, and those substance what deposited into the lung is one of the one of the substances, asbestos. And why the given image is related to the asbestos, I will tell in detail. Okay, so we were here that the patient suffering from ascites and pulmonary embolus and died. So why ascites? If you think about that, why this patient is suffering from ascites, rather okay, if he has some shortness of breath is okay, cough okay, related to the pulmonary system. Now why ascites? So because if you know that if the lungs are failed to perform its function, for example, this is a vessel and this is what the alveoli. So these substances try to deposit into the interstitium. That's why it is called as, so that's why these are called as the interstitial lung diseases as well. So once they start to deposit, they causes decrease in perfusion, decrease in the gaseous exchange. So what happen? Develops these vessels, they have potassium sensitive, sorry, oxygen sensitive potassium channels, and these potassiums are responsible for vasodilation. So once there will be no oxygen or deficiency of the oxygen, low potassium channel open, and these vessels will not dilate, rather they constrict. Number one cause. Number second, because of the blood vessel damage, there may be a chance of formation of embolus that can migrate to your left atrium, left ventricle, may go to brain and lead to stroke. Okay, this condition we can say that because of the vasoconstriction, pulmonary vasoconstriction, and because of embolus there is increased pulmonary hypertension. So because of the increased pulmonary hypertension, it exerts pressure on the right atrium and that exerts on the right ventricle. So once right ventricle has more pressure, it causes venous blood congestion. And once there will be congestion of the blood into the venous return is not so proper, there is a stasis of blood, then it leads to ascites because the hydrostatic pressure increases. The hydrostatic pressure increases means permeability increases. Then the fluid start to leak out from the blood vessels at the abdominal areas. So that leads to ascites. Okay, I think you got some ideas about the question that what they want to ask. So now we will go and we will try to explain the given image. Okay, so in this given image, if you see that it's a piece of some area of lung and there are some marked nodular areas. So this is nothing, it's a lining of the lungs, that is the pleural membrane, or what we can also say the mesothelium. So, and these are the tumorous cells, tissues. So it's pleural lining and these are the mesotheliomas. So this image demonstrates an advanced case of mesothelioma that diffusely involving the pleura and encasing the lung parenchyma as well. So this cancer or the mesothelioma, in which condition we can see? Either we can see in silicosis or asbestosis or what we can say other carbon deposit, that is anthracosis. So the mesothelioma is associated with only or we can say 80% chances of having mesothelioma is condition where there is a deposition of asbestos into the lung. So this patient is he's working in shipyard, he's exposed to the high asbestos level, and now he has mesothelioma, pulmonary embolization, ascites, and because of that he died. So the answer of this question is asbestosis. Okay, asbestosis is the answer. So if you want to just talk something about the other conditions, other options. So aflatoxin B is produced by aspergillosis and it is a common contaminant of cereal, spices and nuts, and it has been associated with the carcinoma of liver. And if you talk about benzene, so benzene, long-term exposure to benzene that can leads to leukemia and Hodgkin lymphoma. And if you talk about the cadmium, cadmium is a carcinogen associated with the development of prostate cancer. It is not associated with mesothelioma. And everybody knows about the silica. So exposure to the silica that may occur in manufacturing of the several materials such as glasses, ceramics and electronics. And silicosis is characterized by a bilateral fine nodularity in the upper lung lobes. It is slowly progressive and it roles as a carcinogen in controlled viscerals. Okay, so mostly silica is associated with tuberculosis. So that's all about this one. We will in next video we will discuss about next question. Thank you.